A cruise ship passenger now back home in Virginia is being monitored for possible hantavirus exposure, according to the Virginia Department of Health. Right now, officials stress there is no confirmed case in Virginia. Authorities say the traveler was aboard the MV Hondius, the ship at the center of the deadly outbreak. Patrick Gray joins us in the studio with more. Patrick.
Dana, that traveler has not been publicly identified, and officials have not said where they are in the state. The concern goes back to the MV Hondius, where several passengers became sick during the voyage, including 3 passengers who have died. Virginia health officials are watching closely, but stress the risk to the public remains low at this time. A traveler from the MV Hondius is now back in Virginia and checking in daily with health officials after possible exposure to the Andes strain of hantavirus.
We're aware of this person. He is in contact with us. That person remains in good health.
The attention centers on the MV Hondius, an expedition cruise ship linked to several hantavirus cases. Doctors say the Andes strain is unusual because unlike most hantaviruses, it can spread from person to person, usually through close contact during the early stage of illness. Virginia Department of Health state epidemiologist Dr. Lori Forlano says the cases to the ship involve the Andes strain. Because symptoms can take anywhere from 1 to 6 weeks to appear, Forlano says public health teams are keeping a close watch on the Virginia traveler.
The local health department is engaged with him in what we call public health monitoring. We'll check in on this person every day.
Dr. Forlano says early symptoms can look a lot like many other common illnesses.
Again, the symptoms would be things like fever, achiness, kind of that what we call a prodrome, flu-like illness.
And if anything changes, she says health officials are prepared to act quickly.
At any point in time, the person reports having symptoms or a fever or something like that. At that point, we would arrange for a medical evaluation, testing if necessary.
For people following the story, that response offers some peace of mind.
I'm glad that they're taking initiative to try to avoid what happened a couple years ago.
Forlano says she understands why some people may feel uneasy, especially after the COVID-19 pandemic, but she says based on what officials know now, the risk to the general public remains low.
I think I truly believe that the risk right now to the general public is low.
And the Virginia Department of Health says at this point, a small number of less than 5 individuals may have potentially also been exposed, but that number is still being worked to confirm. Patrick Gray, 13 News Now.
All right, thanks so much, Patrick. And state health officials say they will continue to monitor the situation and update the public if there are any changes.